How many active patients should a practice have? Obviously, it's an important number. So is there a magic number that makes a potential practice purchase attractive? Well, there's an easy answer and a complex one. The easier answer is no. There's no magic number. Sometimes you'll hear that the rule of thumb is that a practice should have around 900 active patients for every $500,000 in revenue. Maybe, but maybe not. That's where the complex part comes in. Frankly, it really just depends on the specific practice. What's the practice's specialty? How much advertising are they doing? And so on. Context matters. For example, maybe practice A is bringing in $1 million a year, and they're doing it with only 1,000 active patients. Wow. Then you dig into their procedures and you find out that they're overdiagnosing and doing an absurd number of crowns. Probably not sustainable for you, the buyer, in the long term. Or maybe practice B is bringing in $600,000 a year with a massive patient base of 3,500. There's a good chance that practice hasn't archived their inactive patients in years, which means you might have a lot of work to do right off the bat. Point being, active patient count is an important number, of course it is, but there's no way it will give you a full story about the health of a practice. You've got to put it in context. I go in depth on that context in several places, and I hope you'll go check them out. I've got an online course, a free podcast, and a book, and you can find out more about each of them at dentalbuyeradvocates.com.